Hello everyone and welcome to day 2 of week 5. So if you remember in the day 1 video I said that we were focusing on chapter 11 and chapter 36. Now in that day 1 video I did discuss the main topics of chapter 36, which was assisting with the physical examination. And normally, you guys are used to me talking about the second chapter on the day 2 video. However, this week it's going to be a little bit different. So chapter 11 is talking about and discussing the topics of written communication. This is not something that I'm going to be working with you in class this week necessarily on in the lab, so I'm leaving it to you to be responsible to read chapter 11. Now, when we do our quiz review at the end of the day 2 lab class, I will still quiz you on chapter 11, so make sure that you're reading it prior to coming to class this week. So the real question is, what are you going to talk about for this week? This week's second day video, Corey? Well, that topic is going to be health maintenance. So the first question I'm sure all of you have is, what exactly is health maintenance? Well, health maintenance is part of your electronic health record, and it is a way to remind patients of physicians' upcoming procedures, immunizations, lab work, or medications that they might need. Now, as a medical assistant, it will be your job to make sure that those preventative items are met. So, for example, we all know that flu shot season is coming. We know that it starts in September and it goes until about April. And each year, patients have to get a new flu shot. So, let's say that you're going through a patient's chart, or you notice that they come in for their appointment and they have not had a flu shot since 2012. Okay, it's a really long time to not go without a flu shot. It would be in your patient's best interest to not only mention to them that they need a flu shot, but potentially give it to them that day. Health maintenance things such as immunizations, procedures, maybe if they need upcoming lab work, those can already be preset in the electronic health record, and they will fire when needed, either at the patient's appointment, or it will send you, as the medical assistant working with that specific provider, a reminder card saying, hey, this patient needs this update. Or we can actually have those print off letters so that way we can mail them to patients. Another thing when we start talking about health maintenance that we need to know about is ICD-9. ICD-10 just came in to effect not too long ago, but we're going to be focusing on ICD-9 codes. 10 has not really hit very hard yet, and I want to focus on ICD-9 codes because they're a little bit easier as of right now to read. So, as a medical assistant, you may be asked by the provider to provide the diagnosis ICD-9 codes for a procedure. What that is it's the 6-digit alphabetical code number to describe a diagnosis. Standardized coding improves consistency among physicians in recording of patient symptoms and their diagnoses, and it helps the payer, so the insurance company, with reimbursement and clinical researching. So this week in the lab on day 2, we will be using and looking up how to code certain diagnoses in our ICD-9 code books. So be prepared for that. Another thing that comes up with health maintenance that medical assistants can be responsible for is helping out our providers and making it so that way they can see and help as many patients as possible. One thing that I know I do on a weekly basis when I'm doing clinicals is I set up refill requests for the providers. By asking the patients if they need any medications refilled, we can set those up for the provider, so that's one less thing they have to ask in the room, and they can focus more on what is actually wrong with the patient and help to treat them. Now, as a medical assistant, we will need to know what needs to be refilled based off of what not only the patient says, but what was ordered the last time for the patient. What's important to remember is while we can set up those refill requests for the provider, we cannot, under any circumstances, fill that medication. We cannot prescribe it. We cannot approve that medication. That is for physicians only. We can set it up to be approved, but we cannot hit that approve button. Also, you need to make sure when you're setting up a refill request, you know how to read the amount given and how to calculate how much the patient has. So let's say, for example, that your patient has a medication, metformin. They take 1,000 milligrams and they take 1 tablet daily. At the last visit, the provider ordered 30 tablets with 3 refills. That currently means that the patient has a 1-month supply, so that 30 tablets is a 1-month supply, and they have 3 additional months worth of medication. In total, the patient has 4 months worth of a prescription that they will need. They should not need a refill for at least 4 months. Another example is if you look at this label here, it says that they dispensed aspirin 81 milligrams, 120 tablets. So what that means is the patient has, if they take it once a day, they have a 4-month supply right here. Okay? And then they gave them no refill. So again, they have a 4-month supply. They won't need a refill for at least 4 months. And at month 5, they would come for us asking for refills. Here you can see that they gave a quantity of 90 capsules, and they take 1 capsule by mouth before breakfast. So again, they take 1 capsule a day. A 1-month supply would have been 30 tablets. They got 90, so that means they have a 3-month supply with 3 refills. So they will actually not need any refills for 1 year. I know that sounds kind of confusing right now, but we will be working on how to calculate those a little bit more in class, so it won't be as confusing as you think it is. I promise. I'm not a math whiz, but this stuff is easy and to understand and easy to figure out. Alright guys, that's really kind of all I have for you for this day 2 video. I know it was kind of short and sweet, but please make sure that you're reading chapter 11 in completion on your own. Again, that's talking about the written communication. But when we're in class this week, we're going to be focusing on that health maintenance. So I wanted to focus on that piece for you guys. As always, if you have any questions or concerns, please make sure that you bring them to class on day 2. And if not, I look forward to seeing all of you on day 2. And again, happy finals week, or I'm sorry, happy midterm week. Bye guys.